My name is Allison Mice, and this is my Self as a Leader Characterization project. I first started my journey as a leader in high school. I participated in many groups and took leadership opportunities in a lot of the groups. I was an active member of the National Honor Society, I was the vice president of the National Beta Club, and I was the varsity softball team captain, and many more. I continued to lead as a camp counselor at my local camp. I spent every summer providing volunteer service hours as a counselor in training. I got done with that, and then I decided to become employed as a counselor, and I was kind of the counselor leader. I had so much experience that the other counselors looked up to me for advice. They'd come to me to handle a situation or get some ideas on what to do that day, and I kind of became a senior counselor at that job. College was where I developed most of my leadership skills and got the most experience. I was in a sorority and I led as a vice president for 2 years, and in the 4 years I was in the chapter, I was in 6 different positions during my time. I learned a lot how to work with other people, how to make difficult decisions, how to handle people not being happy with those decisions. I learned how to advocate for others, and I learned so much more. Another part of my college leadership experience was being part of the West Virginia Wesleyan Service Scholars and We Lead. During this time, I was responsible for getting 200 hours of community service per semester. I was in charge of leading the freshmen whenever they came onto campus, and I was also a team leader on my We Lead team, which was a human rights team. And together we organized volunteer service hours for other people, and we had educational events on campus where we led group discussions and led initiatives on campus. One influence in my life and in my career is Olivia Persinger. I've worked in my emergency department for 3 years now, and I have met many amazing nurses, but Olivia is one who really stuck out to me when I got to work with her. I'd been a nurse for about a year, and she became the charge nurse on the weekend shift that I worked. And although she was new to being a charge nurse at the time, she adapted very quickly, and I came to realize what a great nurse she is. She is an amazing leader. If you have a critical patient, she's right there beside you, helping you. She's one of those leaders that lives by, if you're going down, I'm going down too. I work in the ER. We have a lot of people coming in and cardiac arrest, respiratory arrest, septic shock, and it can get pretty scary, pretty chaotic, and you're not in it alone. She's always right there beside you, and she's helped me manage the care of some really sick patients. One example that stands out is I'm not used to a patient coming in and choosing comfort. Usually people come in and want everything done, but this family had decided to withdraw all the care that we'd been doing for about 6 or 8 hours down in the ER. And it was just really sad to watch the family member go, because the husband and wife had been married for 50 years or something like that. And the wife was just devastated because the death came out of nowhere. And she helped me comfort the family and their loved one, because it was one of the first times I'd kind of dealt with a situation like that. And she helped me answer all kinds of questions for the family, and she really helped me during that. She will help you with your patients with no question or hesitation. She can make a quick decision under pressure, but also make sure that she puts the patient and the nursing staff first. And she is a patient advocate who will most definitely fight with her patient until the end. It does not matter who you are, she will put up a fight for her patient. One recent story where I had to serve as a leader in the healthcare field was when I was a trained super user. So, Charleston Area Medical Center recently purchased and joined with a bunch of hospitals, one of the first being Greenbrier Valley. I volunteered to be a super user for our EHR program called Cerner, and I went to Greenbrier Valley Hospital for 3 shifts. And I didn't work as a nurse, but I worked as their right-hand man when it came to how to use the new software. It required a lot of patience and a lot of adaptability. I was there the very first day that the program went live at their hospital. There was a lot of stress, there was a lot of chaos, there was a lot of stuff that did not go right. And I was the one person right there in their ER who was supposed to resolve the conflict, resolve the problems. I was the middleman between the nurses and doctors and the IT team. And I helped facilitate how to correct the errors. And it was an example when, as a leader, you need to be adaptable and stay positive, even though it was a rightfully so stressful situation. So here is some peer feedback that I have received from colleagues. One of them said, I'm a natural advocate for others. One said, I go the extra mile to ensure that others feel motivated and understood. Another says she can turn someone's day around with her positive attitude while being a compassionate listener. And a colleague at Wesleyan said she has moved mountains during her time at Wesleyan, and I am confident she will continue with the opportunities that await her. So now we will look at the rest of my journey as a leader and discuss my leadership traits, styles, and goals as a leader as I develop into an advanced practice provider. So the National Organization of Nurse Practitioner Faculties has a lot of domains, but one that I find important is person-centered care. This is a very large domain that entails a lot of competencies, but in particular, I value domain 2.1, which is to engage with individuals with a caring relationship. It is important to provide emotional support, respect, privacy, mutual respect, and confidentiality when taking care of patients. Once this has been established, my patient and I can engage in shared decision making. Regarding leadership, the NONPF believes nursing leaders can use critical and reflective thinking, initiate and guide change, and lead with multiple stakeholders. The American Hospital Association believes that nurses are the most trusted profession and that nurse leaders are an essential part of the healthcare system. The AHA has nurse leaders assigned to specific federal lawmakers to be the point of contact when discussing healthcare policy and advocacy. The AHA also promotes patient safety and protection of private information, which is very important as a nurse leader. The Institute of Health emphasizes core competencies including patient-centered care, working in interdisciplinary teams, and use of evidence-based practice. They also emphasize quality improvement and utilizing informatics, which are, again, all very important when being a nurse leader. The leadership principles that we've learned over the course of the semester that I find important are expert power, referent power, extroversion, and agreeableness, and a coaching style. I think it's important to lead with some sort of expert power as an APP. Patients should be able to trust their provider is making an expert decision and are providing expert opinions regarding their care. The biggest challenge with expert power is that the patient must believe that the person in question and providing their care and information is an expert in their field. If the patient were to question my ability or knowledge or judgment of a situation, then they're not going to seek influence from me. It is an important trait to have because some patients just want their provider to be firm in their decision, and patients want to trust that their provider is making the best decision. So that's why I think that that is going to be an important trait for me to have later as an advanced provider. As important as expert power is, I believe referent power is also important. It is the ability to demonstrate to patients that you have compassion and you're going to treat them with integrity. Nobody likes a provider that's mean and direct, and no one really likes a provider that doesn't include them in their care. So it's important as a provider to always treat your patients with compassion, treat them with integrity, and include them in that decision making. Extroversion is the tendency to be socially engaged, spirited, and adventuresome, and agreeableness is the trait of being accepting, trusting, tolerant, and generous. I believe that these are two traits I practice in my job and I want to practice in my future as an APP. I've been told by many people that I'm spirited and I'm engaged and I make new people in my department feel welcome. I've also been told that I'm accepting and trusting and generous, and I think that that's important to have as a provider. The last principle I find myself using is a coaching style. This is a high directive, high supportive leading style. The leader provides clear directions on how to achieve a goal, but also provides emotional support to the team as they try to accomplish the goal together. I myself have always needed emotional support and feedback when doing something, so I find when I lead that I provide that to people as well. I came to realize this when I was a preceptor for the first time in the ER. I would give my new nurse a task, and then after the task, whether it went good or bad, would provide some sort of emotional support as to how that went. One quality I find I utilize is collaboration. It's important to include every person involved in the patient's care. It is important to promote teamwork, involvement, and promote respect and trust among the whole team. Resilience is a quality I have also used frequently in the emergency department. It is hard to be successful without the ability to adapt because healthcare is an ever-changing environment. It's important to guide others through uncertainty, periods of change, stay flexible, and it is important to have a positive outlook when faced with a new challenge. I really had to develop this skill of resilience when working as a camp counselor and working in my sorority because people give you a lot of pushback and a lot of people are not happy when things are changing, but if you decide to be the leader that stays positive and tries to adapt to the new challenge, everyone will typically follow. The next one is integrity, which I find might be the most important. Honesty, ethics, and trust is important for any leader, but especially when taking care of patient lives. And lastly, I believe self-awareness is essential, and it's something I've worked really hard on. If we don't know our own strengths and weaknesses as a leader, we will not be effective leaders. I believe I have a good sense of self, including my emotions, my fears, my struggles, and my leadership behaviors. And I've spent a lot of time learning and reflecting what I'm good at and where I'm lacking and trying to get better at both. So my capstone project is based on lifestyle interventions such as exercise and diet compared to using medications such as Protonix and preventing symptoms of GERD. So ethical principles are essential to performing any project. It is important to follow the core competencies of nursing such as justice, autonomy, and it's important that we do no harm to the patient, we be transparent, and we promote patient-centered care. This project promotes non-pharmacological interventions that will ultimately promote long-term wellness for the patient. But because it involves people and our patients, it's very important that we follow those nursing principles, protect the patient, and protect their autonomy. Next is spiritual. It's important to lead with compassion, purpose, and a holistic view. Rather than prescribing a medication every time a patient presents with GERD, maybe we need to consider other factors such as anxiety, food, lack of sleep, and obesity. It's important to look at the whole patient, not just the diagnosis. Perhaps they're eating a ton of spicy food and a lot of coffee and caffeine every day. Eliminating that could really improve their symptoms. And it's important to continue to support the patient and provide meaning-driven care. Next is financial. Cost-effective care is important to all patients and all treatments. While medications such as omeprazole and Protonix have become fairly reasonable in price and easy to get, some patients are still going to struggle with paying for that. And a lot of patients are still going to struggle to be compliant if the medication costs too much or it's hard to obtain. Lifestyle changes in the treatment of GERD may save money in the long term for the patient and prevent long-term complications such as peptic ulcers or esophagitis. Last is cultural. It's important to embrace every culture in the workplace and patient care setting. It's important to collaborate with staff and patients with an open mind and consider culture in each patient encounter because each culture approaches healthcare differently. Also, each culture may eat different foods or have different lifestyles, increasing their chances of getting GERD. When discussing where I need improvement, I know I have always struggled to receive criticism. I've always had a type A personality, and I've had a difficult time accepting when I need to improve on something or when something needs to be done differently. I tend to receive criticism as someone is mad at me or I did something really wrong, rather than receiving it as this is something I can do better. Another area I know I need to work on is conflict resolution. I tend to avoid conflict at all costs, and I try to make every party and each person happy. But I'm aware and I know as a leader and especially as a provider, not every patient encounter will go well, and not every conflict is going to resolve easily. It could be with a patient, it could be with a provider, it could be with insurance, it could be with a pharmacy. There's going to be conflict, and it's important that I learn how to come up with a resolution. I know I need to work on my ability to address the conflict rather than hope with time that it resolves. Lastly, I know I need to improve on my ability to ask for help. As I mentioned, I'm a type A personality, which often results in me trying to get things done the way I have it envisioned in my head. I have a hard time allowing people to join my task at the risk that I don't like the way that they'll do it. And I also allow myself to take on too many tasks, and I don't reach out when I need assistance. One challenge I anticipate I will face as a nurse practitioner in West Virginia is scope of practice restrictions. Advanced practice RNs can practice with some independence in West Virginia, but we still have laws in place limiting full scope of practice. Physicians can still oversight a lot of work, and APRNs have limitations when prescribing things such as narcotics. These laws can diminish APRN abilities and eventually delay patient care. As a leader, I want to challenge myself to stay informed, advocate for APRN independence, collaborate with other healthcare professionals, and eventually just promote independence in practice. This will ultimately advance our careers, our practice, and improve care for our patients.